IPR strip from Strauss company. We take impressions and we will get the information which says that we have to do IPR, interproximal reduction. IPR is interproximal reduction. My hand is so big, and whenever I want to do IPR with a small IPR strip, it becomes so difficult for me to manipulate that small space in the mouth. So it becomes very crucial for me. So what I was thinking is, like, we have to find out something, and this handle has got multiple IPR strips which will really help us to do the IPR. So I'm going to show you on a patient also. You can see the thickness 0.009, 0.11, 0.15, 0.22. So this is very useful, and following this video, please watch this video fully. I'll be showing you how to use this on a patient. Hello viewers, welcome to Malligay Dental Academy YouTube channel. If you're subscribing your channel, I'm very thankful to you. If you have not subscribed to our channel, please subscribe to our channel. Today in this video, I am going to talk to you about the IPR strip from Strauss company. I am an certified ortho trained general practitioner. I've undergone a lot of trainings in orthodontics, and I'm teaching orthodontics to many people. One thing I find nowadays, we are using more of aligners, more of aligner treatments we are doing. Especially we take impressions and we will get the information which says that we have to do IPR, interproximal reduction. IPR is interproximal reduction. So when we want to do IPR, which is creating a little bit of space between teeth, so that we can use the aligners to adjust the teeth's rotation and all that minor corrections we can do using IPR. So I always had a lot of difficulty in doing IPR because my hand is so big, and whenever I want to do IPR with a small IPR strip, it becomes so difficult for me to manipulate that small space in the mouth. So it becomes very crucial for me. So what I was thinking is, like, we have to find out something. So I was searching for the internet and I was speaking to some of my friends. Then I found this from Strauss and company, where this Strauss and company, it's an international company, and this is from Israel, where it's a beautiful kit. Today I'm going to do an unboxing video of this Strauss kit. It's called adjustable magic strip system, where you have a handle, and this handle has got multiple IPR strips which will really help us to do the IPR. So I'm going to show you on a patient also. After the unboxing video, I'm going to do it on a patient also. So I will show you that video also. And I also want to share my experience with this after I use. So before that, let's see what is there in this video. Have a great day. Please keep watching. Viewers, this is how the box looks like. It is from Strauss and company. Adjustable magic strip system. Let's open and see. Wow, beautiful. Let's see what they have written here. I am going to just show you first what are the things we have. We have multiple set of IPR strips. Let's see one by one. There are two handles we have, and two IPR strip has been attached here. Let's see in detail how to use this. Okay, I'm going to show you very clearly what it is written. We have actually double-sided and single-sided. Suppose sometimes what happens, generally when we do IPR, sometimes the IPR treatment planning goes like this. Distal of say 3-2 and no mesial of 3-3. Okay, so what we do is we have to use a single-sided strip facing this side. So that is where we use this single-sided strip. Suppose they are telling 0.3 mm on 3-2, 0.2 mm on say 3-3. I'm just giving a random example. So in that time, we can use a double-sided strip because this will work on both the sides. I'm going to show you how it looks on real. Okay. So when you use double side, the stripping effect happens, which means the removal of stripping effect happens in both the teeth. Okay, when we do only one side, it cuts, it strips on only one side. Generally, we have many other, we have burrs, we have lot of things like even hand pieces, but I feel doing by hand IPR is one of the most safest way, because IPR in general, most of them they don't like doing, because it can cause caries after some time. If once the relapse happens, when the if the patient goes for a relapse, the spaces are opening up and the surfaces will be a little rough. So IPR has to be done very, very carefully, meticulously. Don't use your regular burrs. There are some people I know, they use regular burrs also. Please don't use burrs. We have slender burrs available, which I am just showing now in the side. You can see it happens. I am just showing you in the screen. Slender burrs. These are from Strauss company in itself. But if you want to use a strip, this is the best. So let's see how it looks now. So this is the catalog number. You can see the thickness 0.009, 0.11, 0.15, 0.22. So we have this yellow color, red color, blue color and green color, and all these colors are kept here. Before we see that, let's see. This is a single-sided strip. It's written. The single-sided strips are perfect for contouring and finishing composite restorations and for single tooth slenderization. When you want to do IPR for a single tooth, you have to use a single-sided. You can also use for composites. When we are doing diastema closures, when we are doing generally, we need to do composite contouring using this. This is one of the best tool you can use. You won't get a overhanging enamel. Overhanging enamel is not. It won't happen if you use this. Okay, so it is one of the best tool I would recommend for if you want to do a best composite work. And let's see what is written here. Double-sided strips are excellent for contouring and finishing composite restorations, and especially well suited for interproximal reduction. So for interproximal reduction, they are recommending to use all these double-sided strips. Okay, what is the difference between double-sided strips and single-sided strips? I told you already. If the cutting side is on both the sides, it is called double-sided strips. Okay, I'm just going to show you how it is looking in this real life. Before that, I just want to explain the few speciality of this kit. Okay, just carefully see. So this kit is now, see, this strip is now very slender, very thin and very slender. Suppose you want to make it looser, what you have to do, all you have to do is just you have to loosen this. Can you see? I just loosened this. You can see very clearly. It is, suppose you want to do a contouring of the teeth, where the tooth is having a curvature, you want to contour. What I did is I just little bit loosened it, so it became loose. Okay. Suppose if I just adjust this, it became taut. It became very stiff. It is very straight. This part is very straight. I am just loosening it. It becomes curved. So you see very carefully. This is the advantage of this Strauss system. Plus there is one more adjustment where you can remove the handle. Handles are awesome. It multiplies your physics, multiplies your efforts. Without I had a system which I will show you. I used to do like this in IPR. Imagine doing like this is a painful thing, because one finger has to go into the mouth. So some patients feel gag reflex, some patients they feel so awkward. IPR itself is a pain. I know people, if you are a patient, if you have gone through this, there are a lot of patients that tell me, sir, IPR means so difficult, sir, because I do it very slowly. I don't hurry up. So you can use like this also. But I bought this for particularly this handle only, because what happens in this thing is the control, this is very good. You can just nicely do, very easy for you. You can just move right, left, and you can do. Let's see the strip design now. I'm going to show it in close-up also. So I've explained you the handle. I've explained you how to use for contouring. If you want to contour, use close. You just tighten this. It will becomes curve. If you want to use for IPR and all, keep it straight. Okay. Going back to the availability of this different sizes, the yellow color is actually super fine. You can see the yellow color is super fine. The yellow color is super fine. You can see it's very thin. And how you can differentiate between the double side and the single side. Let's see that also. If you all can see here, Single side have got this diamonds on only one side. This is on only one side. This is shining surface. But for double side, there are cutting edges on both the surfaces. You can see outer surface and you can see inner surface. Both are having different cutting edges. I keep both side by side. Single have shining surface on one side, and you can see this is shining surface, non-cutting surface. This is the cutting surface, which is matte surface. This is having matte surfaces on both. In addition, there are some holes. There are some holes there. For efficient cutting, so that when it cuts on both the sides, lot of tooth material, that enamel powder and all will come through it. Okay, so you can use water also to cool it down. Let's see all the other sizes. So this is 0.1 size. So if you just use this, the gap you get is 0.1. okay, here we have 0.15. you can see this is little thicker. This is having double side. Both the surfaces are rough and it is little thicker. And I'm going to show you the single side now. Single side, one side is shining and one side is matte. Can you see it is very thick also? So if you use this, you will get a this is blue color, 0.23. Red color is only 0.15. So actual arrangement should be like this. So they have arranged it wrongly. So this is the it is written here. You don't have to memorize and all. 0.1. This is actually you have to keep it here. It is better we will change it and keep, because the packing is wrong. So keep it here, and as per the thickness they have written, better we follow the instructions printed on it. So this is, I repeat, 0.1, 0.15, 0.23, 0.32. As the number increases, the thickness also increases. You can see it is very thick. So मोटा है ये, thick, बहुत thick है, ठीक है. So ये छोटा है, yellow color छोटा है, ये बड़ा है, ठीक है. You can even write it here if you want with the marker pen also. And we have a gray surface which is 0.05. It is quite thin, and 0.05 is very thin. So this is it is non-diamond coating. It is written here. Non-diamond coating, and this is strip. This magic strips are indispensable for separating fused contacts and cement cleanup. So this yellow color, this gray color is meant for breaking the contact when you are doing a class 2 restoration. If you want to break the contact with the adjacent teeth, so this will be helpful. So this is very useful, and following this video, please watch this video fully. I will be showing you how to use this on a patient with the proper explanation. I will be showing on patient also, so that you can understand how it looks. IPR is such a procedure which needs more of good tools to use. So please watch the clinical video on how to use this magic strip, Strauss magic strip on patient, which I will be explaining you shortly. Hi friends, this practical video I am going to show you about IPR. So I used to use this for my IPR purpose. I used to manual strips, I cut it and fix it here. The problem is, whenever I do, it comes out. I'll put the strip here, I lock it, and I do on patient like this, but it's so cumbersome. Sometimes the papers becomes looser. So I was thinking what else to do. So I got this straw strips, and this straw strips I'm going to use this green color double side. The patient, you can see the IPR report for this patient. The patient was told to, the lab has informed me to do 0.4 on mesial and distal of 4.5. So 4.4, 4.3 like that. So I am planning to do IPR for all these teeth. So this is the strip which I am planning to use in the first place. So let's see how we are going to do. This patient I am going to do first IPR for the distal of 4.5 and mesial of 4.6. So I am going to use a green color strip. The green color strip is around 0.31 dia. Either you can start small or you can go with this. So you should not use vertical pressure, you have to use only horizontal pressure. Slow pressure you have to do, and inform the patient, get the consent, and just do it very slowly, no hurry. It take a couple of minutes to do the work. So please keep doing it. Why? Because see, you can see the teeth is getting slendered, and you can see it in the strip. So Don't give too much of pressure, vertical pressure, only buccolingual pressure you have to give. So this will give me 0.31 of gap, and this is very easy for me now because of the handle, which I used to have a lot of difficulty. Why Tarama? No, Uladama. So this has to be done very patiently. So patiently you have to do. So nicely it is doing its work. It's easy for me. I'm not putting too much pressure. Patient tongue is interacting. Tongue ulla vachukoma. See, it's almost quarter of the blade has gone inside. You have to go little fully. Then again you have to slender only one side. Tongue ulla vaima. The problem always will be the tongue. Why Torama you open panni uda? You can see this is the IPR movement using Strauss strip. I'm not giving, my hands are giving vertical pressure, but the ideal thing is I am not supposed to give vertical pressure. I'm supposed to give only lateral pressure. See, nice lateral movements, buccolingual movements. Not supposed to give vertical movements at all. Tongue. If the tongue is there, it will delay our work. Give a nice support, finger rest and grab. If needed, we can give a mouth gag also. Let's clean that place and see. Since a lot of saliva is there already, I am not using any water. We can use a little bit of water also for cooling down the teeth. Very slow speed I am doing without applying pressure. Only buccolingual movement. I am not giving vertical movement. We might tend to give a vertical movement. I am repeating, don't do. Chances of breakage could be there. This is a double side cutting. You can see it cuts this side and cuts this side also. You can see very clearly. This cuts on both sides. This side also it cuts. This side also it cuts. Let's see. You can use small strips to create a. You can do incrementally also, and also you can just press it down. You can adjust this. You can tighten this. This is for tightening the strip, because as we do, chances of the strip getting curved. I am giving a little bit of lateral pressure on this tooth also. I am doing on this tooth also. If IPR is not done properly, your aligner results won't come. So IPR is very much mandatory. To check this whether we have done properly, we have to gauge the teeth with an IPR gauge. So IPR gauge is very important. You should possess an IPR gauge. This is a very smooth trimming, because generally it used to be very difficult holding this and doing. This is like this handle is a boon. Even Rabbit Force also has got, but I chose Strauss because I believe this brand is good. So as you can see, the strip is becoming more and more engaging with the teeth. You need a lot of patience for this. Patient has to cooperate with you. You need assistance to help you. You cannot do it all alone. See, it's going nicely and freely inside. You can see it is going till the papilla. So let me check with the gauge how much I have done. So I need to keep doing till I get my point. I'm supposed to get 0.8 mm. 0.4 plus 0.4 on both the sides is 0.8 mm. So I'm just rubbing on both the sides. Anterior will be little easier because you can go, the access is okay, but posteriors are little difficult because of the access. You need a lot of patience. If patient is not cooperating, give her anesthesia. You have reached the contact. Now patient is getting restless because of that. So we need to see if she is not cooperating. We have to give anesthesia which is not required. If you can manage, let's check, let's wash that place and check. Nice, IPR has been done. You can see close up. Can you come closer? In the close up you can see, come laterally. I don't think it is much visible in the camera. Thirumbangma konjam. Turn right. Light adima. You can see why tharanga. So I'm going to check with the gauge now. Now I have contoured the, you can see it is slightly curved. The strip has been curved, so that I'm contouring the suction, please. I'm contouring the distal side of the 5, which is mesial side of the 6, so that the contour gives a IPR along the shape of the, rather than cutting the tooth, dicing the tooth. Rather than cutting the tooth, we are, you can see the strip is getting open. Keep removing the saliva. Now I am changing the contour of this. It's curved distally. Now I am just have to tap this. It is going to the other side now. You can see this towards the distal of the 5 now. Soluma. Really good. Why tharanga? Patient is free avukara. Nalla why tharanga? Bite eduthuama. Feelers call pani. Bite vechi kadikka veyanga. Why tharama? Why tharama? Your why mudite pora. When relax irpa. It will take a lot of time. That's why I call you at the time. So completely now tooth is being prepared. You need a lot of patience now. Suction. Hatara. Patient is restless because it is going and touching the gingiva. We can give local anesthesia, but I feel we have given topical spray, which is more than enough. By moving more of buccal and lingual, you will be able to use the maximum of the blade. Otherwise, the center of the blade will get worn out. I'm using you can use a single strip also if you want. I'm using a double strip. Let's check section bottle ella clear pannivi. I'm going to put this 0.4 mm gauge. We need 0.8 mm. This is going freely now, which means we have crossed 50% of the result. You can see here. Free udano tarunika put resist pannakodadu. Just leave it free. So you can see 0.4 mm has been done. Another 0.4 mm we need to do on both the sides, which means we are almost close to 1 mm. I am going to change the handle here. Why? Because the lower part of the blade would have been used. Now this side of the blade will be used nicely. I'm doing it little faster because patient is cooperative now, so to use this opportunity. So it's also working freely now because I'm able to use much of the IPR. So I need 0.8. So I have a 0.5 key and a 0.4 key, or I can use 0.5 key and 0.3 key, which is 0.8. So which will be my gauge. This 2 has to go freely, 1.5 and 0.3. Still I need to do a lot. Till the premolar they are asking for 0.4. You can use burrs also now because the contact is broken. You can use a burr to remove, which will be faster. We have special burrs from Strauss. Same company is selling burrs also. If you want, I will show you one more technique which we can use. We can remove the handle and you can use it like this also. This is what I used to do. So you can use any technique you are comfortable with. like our channel and subscribe our channel. We'll be very happy. I am sharing a lot of knowledge in this practice management tips. If you like to do any of our courses, please visit our website Malligay Dental Academy. We have a lot of courses on endodontics, implants, practice management, orthodontics and restorative dentistry. Keep watching, and even clinical photography also we teach for customized courses. Keep watching, and thank you for your support. God bless you.